Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Thursday, November the 12th, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, Brad, thank you, and good afternoon. Before I comment on COVID for today, I would just like to make a comment on the loss of an innocent 12-year-old boy, and we're all mourning that loss. The evolution of gun violence and its impact on people and neighborhoods is a tragedy. Any death is a tragedy. Any incidence of gun violence is a tragedy in our city, and the death of this young boy is particularly heartbreaking. I've spoken to his mother a couple of times and extended on our behalf, all of the people of the City of Toronto, our deepest condolences to the family. And I will just say that that conversation, together with others that I've had before and after, will cause me to try to work together with the community, most importantly, but also with the other governments and with our police service to try and step up our efforts to address this scourge to a peaceful life and something that is causing immense heartbreak for many people. But again, my condolences go out to the family of that young boy. My message today with respect to COVID is very blunt and very simple. Please stay home. Please don't socialize with people that you don't live with. Please don't have people over. Please stay home, except if you have to go to work or to school or pick up some essentials or to exercise. Putting aside the colors and the numbers and the stages and all of these other things, please just remember this. If you have to go to work or school, please go directly there and back, keep your distance, and wear a mask. If you can work or study from home, please do. And please wash your hands and wear a mask and get tested if you have symptoms, and avoid all crowd scenes of any kind. If everybody did that, if everyone stays home as much as possible for the near future, less people will get COVID-19. We know that. I know it's hard not to have people over, even for a backyard visit or for a meeting in a park. I know it's hard not to see your friends and especially your family and especially some of our elderly relatives in person. I know we'd all like to spend a night out in a restaurant or enjoying good food and good drinks anywhere. I know people want to come together to celebrate their faith, especially now at Diwali time, and to celebrate weddings and other milestones. But I'm asking you as the mayor, as directly as I can, to stay home as much as possible right now. I'm heartened by what the faith leaders tell me in terms of, for example, the percentage of their services across all the different places of worship that are available online. And they're there so that you don't have to leave home, but can still take part in those worship services. Stay home this weekend and watch the Masters or Netflix or football. Read a book. Play a game. Stay in bed if the spirit moves you. You never know what's going to come up. Order takeout food. Cook a meal. Make a Zoom call. FaceTime a friend or a relative. But there's just many, many things to do that can cause you to be in touch and to have a good time, but to please stay home. Go for a walk or for a run. Take your dog for a walk, but do it only with people you live with and keep your distance from other people. Go shopping if you have to, but please do it for the week, and please do it not as a family outing. Go by yourself or designate somebody from the house to go and do these things. Staying home right now, having as many people stay home as right now as possible, as much of the time as possible, will help us stop the spread of this virus. It's going to take time. But the more we do this, the more we follow the basic rules we've talked about for weeks and weeks and months, then the better off we're going to be in the context of stopping the spread of this virus and reversing these alarming numbers that we have been talking to you about. We know the people who are testing positive right now likely became infected about 2 weeks ago, so that the behavior that we engage in now will stop infections from showing up in the coming weeks, and that's how the numbers are going to get better. It's the only way we can get the numbers down during that time. And that's why this is such a challenging virus for us to fight, all of us. And there have been so many sacrifices involved and so much heartache on the part of people having to do their best, as most people are doing. But our work has to be absolutely relentless to get to where we want to be. I want to thank the vast majority of people who continue to do the right thing. and like me, get frustrated when they see other people who are not doing the right thing and who are not following the rules that have been put in place. Pretty simple rules, if you really think about it, to stop the fight of this virus. And that's why I wanted to focus today, not on the red or the green or the yellow or the stage 1, 2, 6, 12, purple, none of that stuff. Just stay home. Stay home. Take every opportunity to stay home that you possibly can, knowing there are a few reasons why people have to go out. Your cooperation is so important and so essential to us winning the fight against this virus, regardless of what the rules are or all the different documents and things that I think sometimes are just confusing. I cannot stress this message enough to everybody in our city. Please stay home as much as you can. If you have any doubt about whether you really need to go somewhere or not, don't go. Stay home. That is what we need to do. That is the right thing to do right now. I thank you very much for your anticipated cooperation, and I will ask Dr. de Villa to give us her report for the day.
Thank you, Mayor Tory, and good afternoon. Today, I'm reporting 500 new COVID-19 infections. 164 people in Toronto are in hospital with COVID-19, and 36 people are in the ICU. Yesterday, we reported 435 new cases. So cumulatively, in the last 5 days, we've reported 2,432 cases of COVID-19. The medical community generally agrees that what is officially identified and reported is just the tip of the iceberg. It's safe to assume, then, that there are more cases of COVID-19 in the community than we identify through testing. As I said on Tuesday, and I will say again today, you should assume COVID-19 is everywhere, and that without proper protections, you are at risk of infection. Nothing has changed, but a lot can change if you are very disciplined in how you spend your time and who you spend it with, and in taking the steps for self-protection that are well known to you by now. Last week, I provided you with an update on Toronto Public Health's work towards resuming full contact tracing and implementing a series of enhancements. I told you about how we are growing to a nearly 900-member full-time team, the largest of its kind in the country, and still growing. I told you about our work with local hospitals to add even more capacity. And I told you about some of our emerging technological tools and measures to confront super-spreader events. Currently, our case and contact staff are exceeding our target by contacting more than 90% of the people with new COVID-19 infections within 24 hours of receiving their positive test result and their contact information. Today, I would like to announce details of some of these new additional contact tracing enhancements we've implemented. We have now launched new automated platforms as part of our case and contact management, so we can reach people quickly and gather more information about their illness. We have a new notification system, drawing upon visitor and customer logs from venues to notify people who may have been exposed to COVID-19. This system has been created to reach more people in a timely way. So let me explain how the system works. Initially, COVID-19 about community exposure. Low-risk contacts receive a text message indicating they will receive a call from Toronto Public Health. Then follows an automatic voice message describing when and where they may have been exposed and providing instructions on how to self-monitor for symptoms of COVID-19. We're going to take a moment here to listen.
Message from Toronto Public Health about COVID-19. This phone number was listed on the patron list for Community Setting X at 123rd Street on October 14, 2020. There were people sick with COVID-19 at this location. This means that you and anyone who was with you at this location may have been exposed to COVID-19. We recommend that you monitor for the symptoms of COVID-19. Other people with higher chance of getting COVID-19. If you get sick or start to have symptoms, please get tested and isolate immediately. Please share this message with anyone who was with you at Community Setting X. For more information, please visit Toronto Public Health's website on COVID-19. If you have any questions, please call our hotline at 416-338-7600 between 8:30 a.m. and 8 p.m. The hotline number again is 416-338-7600. When you call hotline, please quote exposure ID 12345. Please press 1 to confirm that you have listened to this message, otherwise this message will replay. Thank you.
So we've now used this system to reach out to almost 600 people with an average success rate of just under 97%. Additionally, given its success, we are now working to expand the use of the system to send out messages to high-risk contacts as well. We're also introducing the use of an online survey tool to support the collection of source of infection data. After initial direct contact by Toronto Public Health, people with a confirmed COVID-19 infection are directed to a survey that gathers detailed information about things like living arrangements, close contacts, recent travel, social gatherings, and their employment setting. By allowing us to collect information on where people may have gotten the virus or where they may have spread it, the survey will contribute to understanding about how COVID-19 is spreading in the community and will help guide and support the implementation of public health actions to reduce the transmission of COVID-19. Contact tracing is a key part of our response. At Toronto Public Health, our objective is not simply to do it well, but to be amongst the best in the world. In the days ahead, I will continue to update you on additional enhancements and innovations that we are taking and adapting. In the meantime, what every one of you can do is this: don't become a case. The best way to do that is to follow the steps for self-protection, especially now. Try to limit your contact only to the people you live with. So going grocery shopping? Yes. Taking the family along? No. Outdoor dining? Yes. With friends rather than the family members you live with? No. Going for a walk or a run? Yes. With someone you live with? Yes. With your usual running partner? No. In short, don't spend time in social settings. Wherever possible, avoid in-person contact with people you don't live with. It won't be forever, but it should be for the foreseeable future. Infections are very high in Toronto, and we need to get them down. We see how much worse it is elsewhere in the world. If you think it's hard in Toronto right now, imagine what it would be like if Toronto was one of the places in the world where it got so bad that we have to go into a hard lockdown. The way for Toronto to get from bad to better is to deprive the virus of the opportunity to spread. To do that, we have to maintain as much distance as we can. Yesterday, we remembered those whose sacrifice paved the way toward a world we knew less than a year ago. We have the hope of having it back with the promise of a vaccine. Let's not just wait for that second chance. Let's earn it. Please, be one of those people who is doing whatever you can to help us come through this pandemic and starve COVID-19 of its ability to spread. I'll now hand it over to Chief Pegg to deliver his remarks.
Excuse me. Thank you, Dr. de Villa, and good afternoon. From the outset of COVID-19, we've been doing all we can to stop the spread of the virus in our city. This includes both proactive inspection and enforcement, as well as complaint-based response and enforcement. Our COVID-19 enforcement team includes our municipal licensing and standards team and our Toronto Public Health team, who are supported by the city's Legal Services Division. The city's enforcement team works closely and in coordination with the Toronto Police Services team. Immediately upon becoming aware of the upcoming changes in both provincial regulations, as well as the additional orders that Toronto Public Health is implementing in Toronto, our enforcement teams went to work to ensure that we are both coordinated and ready. Our COVID-19 enforcement strategy includes two primary means of ensuring public safety: proactive inspections and enforcement, and inspections in response to a complaint. Our overarching strategy will not change as a result of the amended regulations and orders that come into effect on Saturday. Our teams will continue to be active across our city, proactively inspecting for compliance with the requirements of the regulations, bylaws, and all applicable public health orders. Our residents and business owners should expect to see our enforcement officers active across the city each day and night. In reviewing our enforcement experience to date with our enforcement team, I'm pleased that the vast majority of the businesses in Toronto have been and continue to be in compliance with the regulations. First and foremost, thank you to every business owner who continues to operate in compliance with the COVID-19 related requirements. In addition to proactive inspections and enforcement, we will also continue to respond to complaints that are received. Anyone who wishes to make a complaint relating to non-compliance with the COVID-19 related regulations and orders should contact 311. Complaints are received and processed by 311, forwarded to our enforcement teams, and are responded to on a triaged and prioritized basis. Whether through proactive inspection or in response to a complaint, our enforcement team will investigate and will continue to take any required enforcement action. This will also include the enforcement of the orders being made by the Medical Officer of Health under the Health Protection and Promotion Act. The penalties associated with being found guilty of an offence under the Health Protection and Promotion Act range from up to $5,000 per day for an individual and up to $25,000 per day for a corporation. At present, the orders being made by the Medical Officer of Health include all indoor dining in any restaurant, bar, or other food or beverage establishment is prohibited. All indoor group fitness classes are prohibited, though gyms are permitted to remain open. All indoor meeting spaces and event spaces are ordered closed. All casinos, bingo halls, and gaming establishments are ordered closed, and all indoor and outdoor hookah cafes are ordered closed. I would like to take a few minutes to remind everyone of the requirements for outdoor dining, especially relating to the use of tents and other such structures. The outdoor dining area must be configured so that patrons seated at different tables are separated either by a distance of at least 2 meters or by a plexiglass or some other impermeable barrier. No more than 4 people may be seated together at any one table. If the outdoor dining area is covered by a roof, canopy, tent, awning, or other element, at least 2 full sides of the outdoor dining area must be open to the outdoors and must not be substantially blocked by any walls or other impermeable physical barriers. If the outdoor dining area is equipped with a retractable roof and the roof is retracted, at least 1 full side of the outdoor dining area must be open to the outdoors and must not be substantially blocked by any walls or other impermeable physical barrier. If these dining requirements are not met, then the dining area is considered to be indoors and is therefore prohibited. I remind everyone that additional information related to the COVID-19 regulations, orders, and recommendations can be found on our website at toronto.ca/COVID-19. I extend my sincere appreciation and thanks for every resident, business owner, and visitor in Toronto who does their part to stop the spread of COVID-19 in our city. Thank you.
Thank you, Chief Pegg. Before we go to questions, just to remind reporters on the line that you will need to unmute yourself before you ask a question. And the first question is from Camille Karamali at Global News. Camille, go ahead, please.
Thanks for taking my question. Mine is more related to enforcement. We've been hearing from a lot of people that because they find the new red restrictions confusing, they're worried that they might unknowingly break some of the rules, including the household limit rules. First of all, is that just a recommendation or is that enforceable? And is there some leniency and an education period before the ticketing begins?
So let me take the first kick at answering the question. When it comes to the limits and the advice around social gatherings, those are indeed strong recommendations from me as the medical officer of health. So this is advice that we're giving, strong recommendations, but they are not subject to enforcement. We have seen, though, that the people of Toronto have been very good about taking advice, certainly in our experience in the past and over the course of the last several weeks. And we would anticipate that people in Toronto are interested in doing the best they can to protect their own health and the health of those around them by following that advice and following those strong recommendations.
Maybe I'll just add to that, just to be clear, and these are questions we commonly get with respect to regulations and requirements and orders as things change. What I will confirm, we have never, nor will we ever, take enforcement action related to recommendations. A recommendation is simply that. But the fact that you raised, or the question you raised, made reference to the fact that there is always an expectation or a period of time where people need to come to a point of understanding. I think we've demonstrated throughout our response to COVID-19 that our enforcement teams have always been sympathetic to that and have always taken every situation they respond to into full consideration, taking all of the factors into account, including commonly available information and the like when they're making their enforcement decisions. Last thing I'll say is just to reiterate what I said. All of this information and additional information actually is available on toronto.ca/COVID-19, and I would certainly encourage everyone to have a good look and make sure that we're all up to speed on what the regulations are as well as the recommendations that Dr. de Villa is making.
And just to follow up on that, just to be clear, having spoken to the Peel municipal bylaw officers, they said that they're not going to be checking because it's too tedious. They're not going to be checking, whether after a complaint, whether people actually live in the same home or not, but they're just checking for a cap of 10, if there's more than 10 indoors or more than 25 outdoors. If so, then they'll ticket. Is that also what Toronto's doing? If you can just clarify, please.
Yeah, so as I explained, our response to complaints and our enforcement action will always be limited to enforcement in response to regulations and orders. Some of the things you discussed, like intermixing of families, for example, represent or are examples of recommendations being made by the medical officer of health. Those are not subject to enforcement. Our enforcement activity will continue to be related to circumstances where people or businesses are operating in violation of the regulations or in direct violation of the orders issued by the medical officer of health directly, not the recommendations.
Okay, thank you. We go next to Lucas Meyer from News Talk 1010. Lucas, go ahead, please.
Thank you very much. Dr. de Villa, you mentioned there in the opening that we're putting in these measures to avoid a hard lockdown. Based on the numbers that we're seeing now and the trends and the recent steps that you've taken, how far away in your mind are we from Toronto Public Health, considering recommending to the province that Toronto go into a lockdown? How far away are we in your mind?
So, Lucas, I think you ask a very good question, and I wish I could tell you that there was a simple answer and a simple line that gets crossed, at a certain point in time. But as you know, and as we've seen throughout this pandemic, there are a number of different factors that have to go into the decision-making process, whether we're talking about a decision that's being made here, a recommendation that we might make as Toronto, or a decision that's being taken at a larger level, whether that's at a regional level or at a provincial level. Obviously, we're looking at indicators of virus spread. We're looking at 7-day moving averages with respect to new cases. We're looking at hospitalizations. We're looking at outbreaks in the community. We're also looking at testing data, percent positivity, and also, of course, what is the impact on healthcare and on the public health system, on our capacity to respond. It's all of these things taken together. And then what we see out and about in the community, how people are responding to the orders, the regulations, and the recommendations that are being made that will be taken into consideration in terms of what decisions should be taken, what further actions are needed to control COVID-19 and to effectively protect and promote the health of the residents of this city.
Brad, I'd just like to comment.
I know it's on.
Yeah, Lucas, just before
please,
that.
yes.
I just want to say this. I mean, whatever answer may exist with respect to how far away we are from anything, the one thing that's for sure is if people stay home and if they don't gather together and don't have people over and don't go and visit other people and limit their shopping trips and stay home to work and stay home to do school if they can online, that will take it further and further away from any other kind of measure of the kind that you describe. And so I think people, if they understand that, that's one thing I've come to understand very well. If everybody did that, then we wouldn't have to have this discussion about further and additional measures that are going to be more painful.
And I know this is under provincial jurisdiction, but because Mayor Crombie alluded to rumblings of this, I wanted to ask Dr. de Villa as well. Dr. de Villa, have you at this point at all considered recommending that the province close schools early so that, and there can be more cleanings? Has that thought at this point crossed your mind to recommend closing schools early?
So, Lucas, we never say never to anything. The idea isn't to look at, early or late closure of anything. We have to consider what makes sense for the health of the residents of Toronto. And yes, that includes those who are part of the school community, whether we're talking about students or those who work within the school setting. I will say this. It is really important from a public health perspective, as we've been responding to the COVID-19 pandemic for the last several months now. We have been unwavering with respect to the objectives of the response. Right? What we're trying to do is limit the negative impact of COVID-19, both in terms of lives lost and illness associated with it, to preserve our healthcare system and to ensure that we're mitigating to the greatest extent possible the broader health, social, and economic impacts. So one of those broader health impacts has to do with school. We know that attendance in school is really, really important to the health of our children. And it's not just about the academics, it's about the sum total of how schools actually contribute to the health of our young people. So to the extent possible, we want to keep our schools open, but of course we want to make sure that our schools are open safely, right, in as safe as possible a manner that can be achieved, given that we're in the midst of a pandemic. But of course, we're constantly assessing, constantly monitoring, and constantly making sure that we're doing the best we can with the information that we have and the best available science to create safe environments. And as the mayor just said, in order to keep schools going, in order to get all those benefits for our children, what we really need is for people to do the best they can to stay home as much as possible, to limit their social interactions outside of close contact with those that they live with.
Okay, thank you. We go next to Mark McAllister from City News. Mark, go ahead.
Thank you very much. You're both seemingly a little more pointed in your messaging today, simplifying it beyond that. How important is it for you to try and get that message through? It seems as though you're doing more than you have in recent weeks.
Well, you know, Mark, I'd like to think that we have been trying to get this message out for several weeks now, and we're always trying our best to get the message out there. Clearly, the situation is urgent. We are seeing, as I've described in the remarks, some significant case counts, incredibly high case counts, and we do see great risk here at the city. What I think is really important, though, is that we can control this. We do have science that tells us exactly what needs to be done in order for us to, together, promote the best health situation for the residents of Toronto. And that is simply this, to limit social interactions to the greatest extent possible. We're asking people to stay at home, to only have social and close contact with those with whom they live, and 1 or 2 essential supports, particularly for those who live alone. To the extent that we can limit those contacts, to the extent that we can limit social gatherings and those kinds of interactions, we know we can actually reduce COVID-19 spread in our community and get us back to where we would like to be.
You know, Mark, I'll just say this. This is a complicated area involving multiple governments. They all have accountabilities and transparency that they're trying to exercise. But what you end up with then is people focusing on stages and color codes and frameworks and rapid testing versus regular testing and contact tracing. And it gets pretty complicated for people. It gets complicated for the people who are involved. But for the people that are make up the population of the City of Toronto, I think we're trying to be very clear that the #1 thing they can do without worrying about colors and stages and rapid tests versus other tests is stay home. Stay home. Work from home. Study from home. Don't go out except to shop once a week by yourself. Don't go out to do anything unnecessary. You can get a bit of exercise, but do it only with the people you live with or by yourself. And that is really what we do have to emphasize, because if everybody did that and wore their mask and kept their distance and washed their hands, I think we'd be in a much better place a very short period of time from today, relatively speaking, to the duration of this whole nightmare.
To follow on that then, and you're well aware of this, and you've heard this probably in response to the message. For those who cannot stay at home, what is your strong recommendation and what is your advice to those people?
Well, I said it, and Dr. de Villa may wish to follow up from her perspective as a medical doctor, but go directly to work. Go to work with every safety precaution taken, wearing a mask, going directly to work and coming home and not sort of socializing. At work, I hope that employers are enforcing the necessary safety requirements so that people can work safely. And quite frankly, if somebody isn't an employer, then report that under the occupational health and safety legislation or take other steps to make sure that those kinds of things are addressed. But because people do have to go places, they have to go shopping. But when it's the shopping, go by yourself, go once a week instead of 4 times a week, go directly there and come home. And cut out all of the unnecessary socializing. Unnecessary meaning at this time it's not only unnecessary, it's hurtful to us in our efforts to combat this thing. So don't have people over. Don't go places even for a couple of minutes to see somebody. Do it online or phone somebody, but we just have to have people adhering to that.
So I think the only thing I would add to that is for those of us who do have the luxury, right, of working from home and who are able to study from home and do all, maintain that distance as much as possible. It's beholden on us to do that to the greatest extent possible so that those who can't can continue to do what they do to keep our city running. We know that healthcare workers need to attend in person. You can't deliver patient care remotely, or there are some elements of patient care that really need to be delivered in person, and we need those people to continue that. There are other essential services. We need our grocery stores running, our pharmacies running, for example. So those will have to continue to be in-person types of settings. But to the extent that we can all help them, people working in those essential services, to continue to do their work as safely as possible, I think that's beholden on all of us. It's part of our civic responsibility, and it's what we can all do to contribute to reducing COVID-19 in our city.
Okay, we'll go next to Dave Ryder from the Toronto Star. Go ahead, Dave.
Hi there. For both Mayor Tory and Dr. de Villa, I'm guessing you either read or are aware of the Toronto Star story today revealing that the provincial framework does not follow or was not in line with recommendations from Public Health Ontario. I'm wondering, and since then, Dr. Etches, the public health officer for Ottawa, has said she thinks the framework that was released by the province, that the thresholds are too high. Can you respond? Do you think the thresholds under the provincial framework are too high?
You know, David, we've talked about frameworks, and you've heard the mayor comment on colors and stages and this kind of thing. You know, what I will tell you here is that we have been extremely focused, steadfastly, focused here in the City of Toronto on assessing what our situation is, what we see as the risk of COVID-19 in our community, and what we've been doing all the way through is focusing on those actions that we believe are best supported by our own experiences of the past, by the best available evidence, and by the experiences of other jurisdictions in order to control the risk here. My job is simply this, to do the very best I can to serve the residents of Toronto. So I'm not particularly interested in debating on the thresholds or the framework. I am extremely focused on ensuring that we do the best we can here to protect the health of the residents of Toronto. And that's what people in Toronto can count on me to do.
David, I will just say that these thresholds are set out in a framework, and in some respects they're important, but in other respects what we've shown here, Team Toronto as it were, is that when we thought that those kinds of things didn't best suit the needs of our fighting of this virus, we took steps to go beyond that. And I will say, to give him his due, the Premier supported those steps yesterday and said that those were things he would support for Toronto. And I think that's what's important here, is that we are doing what we think is best for our city, our team here, and that we're being supported by the province, and we're doing it in a way that is looking at frameworks and colors and different thresholds as being obviously important because they're set out by the provincial government, but at the same time it's not stopping us from doing what we think is right and recommending what we think is right, and hopefully getting the support of everybody and actually carrying through to do those things, including people just staying at home. That's just common sense. That's not in a framework. It's not in a regulation. It's just something that people should do.
Thank you. And the follow-up question is, Dr. de Villa, on CBC Radio this morning, when you were asked about restaurants and the part they play in virus spread, you mentioned that gathering places, including bars and restaurants, and then you talked about places of worship. But one of those things is covered by an order, and one is just a recommendation. Did you consider making an order about places of worship and religious gatherings? And if not, why not?
So when it comes to public health practice, we try to use the least restrictive means available, you know, depending on what the situation is, right? We're trying to achieve certain public health outcomes, and the goal is really to do so in a manner that uses the least restrictive means, right? There is, I think that's just a matter of good practice. So we have had the opportunity, and I know the mayor has had the opportunity in particular, to speak with places of worship, and we understand that in fact the vast majority of them are have moved to online or virtual services. And so right now we're taking what we feel are appropriate actions given the current situations here in Toronto and given the current risk premised on what we're seeing out there in practice in Toronto. Of course, if we have to change, that's always an option that's available. That's basically good public health practice. See what's happening, monitor and assess, take the appropriate science-based, evidence-informed actions in order to control public health risk and to best protect the health of the public.
Can I just add to that some information that I have gleaned from my conversations, which I said I was going to have with some of the religious leaders in the City of Toronto, and I've talked to the leaders of many of the different faiths, and I will tell you, first of all, as the medical officer said, the vast majority have put in place ways in which they can have their services made available to people virtually, and they find a great number of people are taking advantage of that. Secondly, I'm extremely impressed at the policies that a lot of these faiths have across their places of worship in Toronto to disinfect, to physically distance, to change some of their routines to be safe only because of the advent of the pandemic. And thirdly, I am heartened by the fact that they are going to comply with the recommendations that have been set out, and they're going to do their very best to make sure that compliance is the order of the day. In the case of, I will say, one particularly big, for example, Hindu Mandir in Toronto, it's the time of the year when they would ordinarily have thousands of people coming to that one place alone to celebrate Diwali, and they're closed. They've closed themselves because they recognize the fact it's very difficult when it's an important holiday or occasion like that to regulate 50 people at a time, so they're making it all available online. They're going to find different ways to celebrate Diwali for this year, and I just hope that's being followed, as I think it is, by many of the other places of worship, whether it be Hindu or other in the city. And so I'm very heartened by the response that I've had and the interest that these faith leaders have in helping us with what we have to do here to try and fight this virus. As important as they would say, and I acknowledge, prayer and worship are to so many people in our city.
Okay, thank you. We go next to Josh Freeman from CP24. Josh, go ahead.
Hi there, good afternoon, and thanks for taking my question. We're hearing a lot about public health advice being flouted in condo and apartment building settings. We've heard a number of stories about parties being held, and we've seen video of people packing into high-rise elevators, not wanting to wait their turn and not wearing masks, despite the objections of other residents. I'm wondering if you're contemplating any steps or additional actions to hit the message home in these high-density settings that rules need to be respected, and also what can people do if they live in a place where they're surrounded by neighbors who aren't following the guidelines?
So actually, this is the first I've heard of that, and I'll certainly go back and speak with the team about that. You know, it's my hope, my sincere hope, that as we put this messaging out there and we describe the current situation in our city, that people will really appreciate that it is those kinds of events. I think some people think that, you know, this can't be serious, that it's not going to happen to me, it's not going to happen in this setting. You know, people think that they're with their friends or with their family members and that they couldn't possibly get COVID-19 from those individuals. But of course we know that they can, right? It's all about close contact. So to my mind, you know, that tells us that we need to redouble our efforts and make sure that we're getting out there in ways that resonate with as many people as possible in our city around what they can do individually and how important it is for them to limit social interactions and to take this advice as seriously as possible.
May I just say that if it's possible to take a picture or a video of an overcrowded elevator and people going up and down to attend big parties, then it's also possible to use the very same phone to call 311. And I think you've heard Chief Pegg and others report in previous times that when we get those complaints, we follow up on them. And there'd be nothing like a bylaw officer or a police officer to actually be right there on a hot spot where this is going on repeatedly to stop that behavior from occurring and to stop the risk that Dr. de Villa made reference to of people contracting the virus because of being in crowded elevators or being at big parties. So please, we're not trying to turn the whole city into a place where people are turning each other in, but that kind of dangerous behavior is something that is completely against everything that we're saying. But we need to know, you know, where this kind of stuff is going on, especially if it's happening on a repeated basis, so that we can have somebody come out and look into it and do whatever is appropriate to deal with it.
Thanks very much. And just as a follow-up, Mayor Tory, you alluded earlier in your remarks to the province's new color-coded system. Others have criticized that system as being confusing. Do you think some of that confusion might be contributing to people perhaps not following health advice because they're not sure what they should be doing? And has that been part of your discussions with the province?
My comments are not meant to be critical. They're simply an acknowledgement of the fact that I don't know how any citizen who isn't spending all the time that we're spending trying to understand all of these different guidelines and recommendations and frameworks and stages and colored reports, how they could possibly keep up with it. And so I was trying to make sure that the message today that we're really trying to put out there, beyond what all of those documents say, is very simple. Stay home. Don't go places you don't have to go. There are some people who have to go places. Go directly there, wear a mask, and come back. Go shopping once a week. You know, but basically stay home. Don't have friends over. Don't go and visit friends. It all sounds pretty grim, but the situation is grim. And so it isn't meant to be critical of anything. It's meant to say that it's very confusing for lots of people, most people, to keep up with all this information and all these different documents. So just stick to the basics, which are pretty easy to understand. Stay home is not a hard message to, you know, to try to comply with if you possibly can.
Thank you. We go next to Ann Gaviola from BNN Bloomberg. Ann, go ahead. have to unmute. There you go.
Hi there. This is, as he said, Ann Gaviola with BNN Bloomberg. On our channel, we've been hearing from a lot of people within the restaurant industry across Toronto telling us about what a difficult go they're having. And this topic came up again in the Senate Finance Committee. So my question has to do with the decision to extend the indoor dining ban. Some members of the industry this morning in Senate said they felt they were being used as a scapegoat to send a message to the public to take coronavirus seriously. They wanted to know, does the data show that indoor dining in restaurants are a key factor in community spread? And I ask this recognizing that your language today is much stronger than we've heard in the past. I say this because so many of them tell us that they're just hanging on by a thread.
So, first and foremost, I really do appreciate that this has severely impacted, negative impacts on the hospitality sector. And I can, I really appreciate how very, very difficult it is for those who own businesses, operate businesses in that sector, and those who work in that sector. That is not lost on us. However, what I can say is that we have seen declines in COVID-19 infection rates as a result of the restaurant and bar closures, the closures that were affected within the hospitality sector. We also saw that there were some very specific benefits in neighborhoods in particular, where there were many young people and many bars and restaurants, a very active bar and restaurant scene. We saw very, very significant case rate declines. Things, there was, again, neighborhoods in Toronto, over 600 cases per 100,000 dropped down into the low or mid double digits. Other neighborhoods where it was more in the range of 200 per 100,000. And then with the measures being introduced and the reduction of activity happening within that hospitality sector, also down to the low double digits per 100,000. So, there has been clear evidence of benefit as a result of those closures. Further, there is an increasing body of evidence in the scientific literature that shows that amongst the places that are likely to give rise to super spreader events and ongoing transmission of COVID-19 are places like bars and restaurants. We know that closed spaces with crowds and close contact between people, particularly if those places are characterized by activity where it's difficult to wear a mask, like having a meal or eating and drinking, those kinds of environments are exactly the kinds of environments that give rise to the spread of COVID-19. That's the reason why we have taken the action that we have in respect of maintaining the closure on indoor dining.
Can I just add, first of all, that the notion that any of us in sitting to discharge these extremely difficult public responsibilities would look to scapegoat anybody or make an example of anybody is just, it couldn't be further from the truth. We've agonized, as I've said many times, over these decisions because we know about the impact that they have on people and on people who have invested in good faith and built up businesses over many years. But we have seen, as Dr. de Villa said, we have seen dramatic, not just tiny, but dramatic decreases in the case count numbers, relatively speaking, in the period before that those measures were first introduced on indoor dining and after. And at a time when things are spiking again as part of this second wave, it was something that was discussed at length in terms of the efficacy and the need to do it at length. There were lengthy discussions held. None of these things are done lightly. I will tell you one other thing that certainly has been on my mind as we've gone through this and as you read and as you look, is that every other major global city in the world, virtually without exception, has done this. And in fact, in places like New York City, they've never opened indoor dining. And there may be people in our business here who would say, well, we wish we hadn't opened for an interim period of time. And maybe they're right. But the bottom line is there are cities where it's never opened, where it's been closed for a lot longer. And I sort of ask myself the question as we go through this as a matter of basic common sense, could all of those people in all of those cities, virtually all over the world, be wrong in saying that that is something that is going to contribute to stopping the spread of this virus? And the final point that I've made, because I've talked to many people in the industry, and I'm, by the way, fighting very hard, and I'm fighting with a receptive audience to make sure the federal government in particular gets its excellent assistance program up and running and gets the money out the door as soon as possible, which they're trying to do. But, you know, at the end of the day, what we're doing in taking these measures, and I think, again, we honestly believe this based on all the discussion and all the expert evidence we can get, is preventing something much worse and much longer from happening later. You know, so that a few weeks or a few months from now, we're not confronted by the notion of having a long, long period of complete lockdown of everything. And I think we've always been trying to avoid that and avoid damage to the healthcare system. But the notion that we would ever think of doing anything to kind of make an example or make a public policy decision on that basis is, it just doesn't make sense.
Follow-up, Ann?
No, thank you.
Okay, thank you. We'll go next to John Chidley-Hill from the Canadian Press. John, go ahead, please.
Good afternoon, Dr. de Villa. This question's for you. Do you consider the current restrictions in the City of Toronto a so-called circuit breaker lockdown? And if so, how long do you think it'll have to be in place for it to be effective?
So what we've done in the City of Toronto is look at the data that we have, looked at the situation that we see here in terms of COVID-19 transmission, and done the best we can in terms of putting in measures in those places where the science and our experience tells us will make a difference to reduce COVID-19 transmission. And as you've seen, some of the measures we're taking are put forward as strong recommendations or as advice, and other of the measures that we're taking have been put forward as orders, and so have more force under the law. But the combination, it's the suite of actions that we're taking together, along with the specific public health measures of case and contact follow-up, that we see as the package altogether to reduce the risk of COVID-19 transmission in our city so that we can get our city back. That's really what we're trying to do. You know, I try not to predict too far in the future, simply because we are still very much learning. None of us have ever been through this before. This is a new virus. I keep reminding all of us here that this is a new virus, one that was only discovered in January, and we are learning our way through a very challenging situation. Clearly, other jurisdictions all around the world are also learning in a very similar fashion to what we're going through, and we're trying to glean lessons learned from other jurisdictions. We've seen that it does take some time to, you know, see the full impact of any measures that we take. But we do know this, that any measure that we take here as at local government or at any other level of government will always be enhanced the more that each individual member of our community adopts the measures for self-protection. The more you are able to stay at home and to limit your social interactions with other people, particularly limiting your interactions such that you are focused in your close contact as much as possible only with those with whom you live. The more we can stay home, the more we limit social interactions, the sooner we will see the impact of any intervention and measure that's been taken to date, and the sooner we get our city back.
Thank you. And as a follow-up to both you, Dr. de Villa, and you, Mayor Tory, you've both come out with a very strong, clear message today about the importance of staying home unless absolutely necessary. I'm curious, why today is there such a clear, strong message from the two of you and not earlier in the week or last week? Like, why the sense of urgency for today in particular?
I'll start on that and simply say that if we deserve to be criticized on a communications basis, it's because we haven't maybe singled out the message about staying home and things that go with that in terms of wearing a mask, keeping your distance, washing your hands. And we've surrounded it often by other news we thought we needed to convey about things that were going on or other explanations about stages or colors or any of these kinds of things. And I think that, you know, if you boil it down to its core, certainly from me, because I'm not a medical doctor, I'm the mayor, and I've learned, though, from listening to Dr. de Villa and others about the simplest things that are going to make the biggest difference that individual citizens can do. And so I think that, you know, we've been saying these things pretty much every day, I think if you go back and check. But I think now we're trying to sharpen it up to say to people, because it is going to be at the end of the day, not the experts and, you know, not even the hospital presidents, God bless them, and the public health experts that are going to resolve this. It will be people through their own behavior, and not even because there are rules in place, just because common sense tells them, based on the best advice we can get and best practices around the world, that if you stay home, wash your hands, wear a mask, keep your distance from other people, avoid crowd scenes, that, you know, we're going to stop the spread of this virus. We can. It's been shown elsewhere.
Yeah, I think the only thing I would add to what the mayor has already said is that, you know, we have seen, you know, our case counts increase in the last few days. As I mentioned earlier in my remarks, in the last 5 days, we've reported, you know, just under 2,500 cases of COVID-19. So there is an urgency to our situation, hence an urgency to our messaging. And as the mayor says that, you know, we try to be as clear as we can and as focused as we can on our remarks. There are moments where we have many other things to discuss with the people of Toronto. But I think at this point in time, given our current situation, we really do want to emphasize this notion of stay home as much as possible. We know that we can do this together. The more we are able to stay at home, to limit those social interactions, the sooner we will find ourselves in a position where we can eliminate or reduce the spread of COVID-19 and start to get our city back and start to get, you know, back to life more like we knew it before COVID-19.
Okay, final question is to Nick Boisvert from CBC. Nick, just a reminder to unmute yourself. Go ahead, please. Nick, you there? I see you're unmuted. Go ahead. Let's mute him and then try and let him unmute himself. Go ahead. I'm sorry, Nick. We're not hearing your question. I apologize. If you want to send us an email, we'll try and get an answer to you after this press conference. Apologies. Everybody, thank you very much for joining us. That concludes today's briefing. Please stay safe.